You're tuned in to The Big Show's Good Morning Doctor, brought to you by Parkway Medicentre. We've got you covered. Visit parkwayMedicentre.com.sg today to find out more about our one-stop centre for all your healthcare needs.
Waking up Singapore. Gotta get up. The Big Show on Kiss 92. Gotta get up.
Good morning, and we welcome Dr. Tricia Chang, Deputy Clinical Director from Parkway Medicentre. Good morning, Doctor.
Good morning, everybody.
Good morning, Doctor. So today we're going to bust some myths. Like, well, not myths, but I think misunderstandings about where people should go when they're not feeling well, when they've broken a foot, when they've lost a finger, you know? Like, they're different.
Wait. You're talking about me when you just said
yes,
broken.
Of course we are. Always talking about
I don't
you.
think it's getting any better, so I'm going to ask the doctor in a while where I should go.
Okay.
GP clinic,
Urgent
A&E,
care.
or urgent care.
Urgent care center. So firstly, this is the first time I'm hearing the term urgent care center. What exactly does that mean, doctor?
Yeah, so maybe let's have some background.
Yeah.
So, you know, A&E, I'm sure everybody knows, everybody goes there for life-threatening conditions that need to be seen immediately. Okay, so like if you think you're going to lose your vision, lose a limb, or you might even lose your life, of course the A&E is the place that you should go to. But if it's not so life-threatening, just urgent, you just need urgent attention, you can consider an urgent care center. Of course, the GP is usually the first port of call for people with acute symptoms, with new symptoms that bother them. Of course, GPs also see chronic conditions like diabetes, hypertension, and they give lifestyle advice, counseling, they prescribe medications. Usually, it's the first port of call. So, urgent care is sort of like an in-between. It's not the chronic condition, not just a very mild symptom. It's kind of urgent, but it's not life-threatening.
Oh, okay. So I use myself as an example.
Yeah.
Okay, so my foot has been troubling me for the past 2 weeks now,
Okay.
right? And I went to see a physio, and without going for an X-ray, she did tell me it looks like a little hairline fracture,
Okay.
right? Because, I mean, she's seen many runners before, and they experience these sort of fractures in their foot. So I have my doubts, right? I feel like maybe it's a little bit more than just a hairline fracture, because I've been taking milk and calcium and stuff like that, and I still feel like it's not right. You know, like I should be healing a lot faster. So this would be urgent care.
It can be seen in urgent care, but we see common cases like this in the GP as well.
Okay.
The good thing about the urgent care center is that we have on-site facilities like X-rays,
Okay.
Oh, right.
with
Okay.
ultrasounds, we have bone mineral density scans,
Right.
We have mammogram machines. So all these helps us to diagnose and treat the patient earlier, so we can deal with urgent cases better. So, for example, in your case, if you come to us, we can immediately order an X-ray.
Yeah.
A doctor can go over to the X-ray room, have a look, and we wait for the official report, and we see what it shows, and we can immediately institute some treatment in the meantime.
I think that should be the way, right?
That-
Because
that
I mean, you
sounds
wouldn't
good.
know if there's no X-ray. The only
Yeah.
way to find out what it actually is
Yeah.
if I
Get an
go for
X-ray.
an X-ray.
Yeah, that's right.
Okay.
Yeah.
So that's interesting. That's with a fracture. When we come back, I've got another situation that I want to clear up because I'm not sure whether it's urgent or A&E.
Is it
All
a
right.
personal thing?
No.
Okay.
All right, we're speaking to Dr. Tricia Chang, Deputy Clinical Director from Parkway Medicentre. Up next, Anne-Marie featuring Khalid. This is You and Me.
You
Or
and
I. Same difference.
Okay.
On Kiss 92.
So I'm looking at it from a parent's point of view. Glenn's got a hairline fracture. You're saying he can go to urgent care.
Or at least that's what I've been told.
That's what you've been told. You can go to urgent care. You can get the
Suspected.
X-ray done, and everything will work out. The fear, and I'm going to be very honest here, the fear of a lot of parents with their kids is, I go to A&E, it takes hours.
6 hours sometimes. It's
It takes
Yeah.
hours, okay? I mean, I had the most horrendous experience with my son-in-law, but that's a story for a different day. Kid breaks his wrist.
Yeah.
Urgent care, A&E.
So if like falls, For falls, minor head injuries. Yes, they can be seen in urgent care.
Right.
Yeah, as mentioned, we have X-ray facilities.
So you can. I don't have to go to an A&E.
You don't really have to go to an A&E unless it's like an open fracture. It's acutely bleeding. You might lose a limb, kind of
Bone
thing.
sticking out, kind of thing.
Yeah, if it's just like might be just a sprain or a bruise, you can consider urgent care. So urgent, but not life-threatening. So I think that's the main point for when to see urgent care. Of course, good thing is we have the facilities to do the necessary investigations. We also have nurses on with us who can do the bandaging. We can do casting if needed and everything. Yeah, so basically we can provide similar service as though you went to A&E. Yeah, but you don't clog up the queue there.
You don't clog up the queue.
And so the waiting time will hopefully fall as well.
Yes.
I have a question. You said minor head injuries.
Yes.
For every parent, any injury for a child is major.
Yeah.
So how do you qualify what's minor or major? Because they could hit their head and it may not show, but something else is going on inside, like a concussion. So how do you know when it's urgent or when it's an emergency?
Firstly, we look at external scalp. Is there a laceration? Is it acutely bleeding?
This is for the parent, right?
To
look at first.
For the parent,
okay.
yeah. If it's a laceration, it needs to be stitched up. And we have stitched up similar cases in our center as well. Of course, there are worrying symptoms to look out for. We call them red flags. Would be like vomiting, drowsiness, not active anymore. They refuse to play.
Like blackout, maybe.
Yeah, blackout. So those are a bit more red flags kind of thing. But if the child is otherwise well, eating well, playing, still active for the last 12 hours to 24 hours, and it's maybe just a little bump there. Actually, we can monitor.
Okay.
Yeah, that's what the A&E doctor may also.
GP clinic.
GP.
If I had a kid and he or she bumps her head or whatever, even if he is running around, I would say, okay, let's go and see the doctor.
Just in case, yeah.
Because I just want a reassurance from the doctor. They tell me like, no, I think he or she is okay.
Yeah.
Is there something that people should start thinking to do when something happens? Go to your GP first. Get that recommendation. Do I go to A&E? Do I go where?
Yeah.
Is that what we should be doing rather than just rushing to A&E straight away?
Yeah, I think the thing is there's a lack of awareness of this urgent care center. I think the new centers only opened up in the last few years. For like decades, there's only like GP or A&E. There's no in between. It's either you go to your regular primary care provider or you rush to the A&E if you think it's very urgent or it needs immediate attention. But in actual fact, if you're not sure, you can always go to the GP and a GP or an urgent care center, and they can escalate if needed. Of course, it might be really serious that we can't handle it here, and we will write a referral to the A&E. And we have programs such as GP First and Peace Engage, which encourages patients to see the GP first. The program is literally called GP First. So we sort of like filter and triage them, and we say, okay, your condition is quite serious. It may need an admission. Let me fill up this form. I'll give you the form. And if they go with the original form, they do get a $50 discount at A&E.
Okay.
So it sort of encourages patients to, hey, maybe I see my GP first, or I see an urgent care center first, and we see if it's really needed for me to go to the A&E.
You say that the urgent care centers only just recently opened up in the past few years, right? How many are there in Singapore? And the second part of my question is, are they walk-in clinics?
Yes, most of them are
like an A&E.
But most of them don't open like 24 hours.
Okay.
Some is until 12, some is until 10.
12 midnight?
Yeah.
Okay, all right.
Yeah.
That's a good time.
Yeah.
And where are they located?
There are a couple in Singapore. I think there's one at Alexandra. Yeah, there's a couple in the West. There's also private ones, like ours.
Okay.
Yeah, so a couple.
Woodley Mall.
Woodley
So yours
Mall.
is Woodley Mall.
So they're well spread out, basically.
Yes.
Okay.
Yes.
Okay.
Woodley Mall, so
Woodley
nice
Mall.
and
Yeah, I
convenient.
still haven't been. We should go.
Yeah.
Yeah.
We should go.
Go
We
to the
should go.
clinic and then go shopping.
Correct. Yeah, but why clinic?
How awesome is that?
if you
When I say
need to.
clinic, I mean that facility. What is your facility called? I mean that entire
old
clinic.
building.
It's called
No.
Parkway Medicentre.
Parkway Medicentre.
Yes.
Okay, and it's got all sorts of clinics in there, all
Yeah.
sorts of professionals.
So we have three main sections. One is the family physician clinic, the GP clinic. The other one is the urgent care center, where we have the treatment rooms, we have the facilities needed, and we have also executive health screening, where patients come for health screening. Well, patients come for their routine health screening. And finally, we have a specialist area as well, where we have in-house specialists as well as visiting consultants that come in once or twice a week to see the patients.
Okay.
So it's like all under one roof.
I love that.
Yeah.
All under one
Yeah,
roof.
no, that's a good idea to
I was
have
just
everything
telling
there.
Dr. Melvin last week when he was on, and
Yeah.
Dr. Melvin is also from Parkway
Medicentre.
that I want my flu jab.
Yes,
yeah,
yeah.
sure.
So good. I can go and get my flu jab, and at the same time,
and scan
I
your
can-
foot.
Yeah. Have an
Sort out
X-ray.
everything.
Yeah, man.
Under one roof.
And then you can shop and eat.
And then after, yes,
Shopping.
I'll go and do grocery shopping.
Couple of things that come through on our Facebook page. Raymond, who stays out in Woodlands, has already found his urgent care center.
Oh, good.
Yeah.
Okay, all
He's
right.
found it. Siu Cheng asks, though, with all this happening, where does the polyclinic now sit
yeah.
in this whole...
Yeah, polyclinic is large scale, massive kind of big clinics with also all these facilities there at subsidized rates from government. We have government subsidies, so patients, for example, with those Pioneer, Merdeka generation,
Yes.
Medicentre, CHAS, and all that, they can also go there. And the only thing is, it's definitely more crowded.
Your waiting time again, right?
Waiting time. The appointment might be very long.
Yeah.
Yes, yeah. Sometimes you call them,
Yeah.
they're like 2 months in advance or
Yeah,
something.
exactly. Yeah.
But you still have that choice. I mean,
Yeah.
if you want to go for that, you go for that. If
Yeah.
you're waiting for too long, then
Yeah.
go somewhere else
It's-
where
it's
perhaps
speed.
maybe
It's
you,
speed.
you,
It's
you
speed.
don't have to
Yeah.
wait so
Yeah.
long. Okay, traffic update coming up. Stand by.
Be just like you were never gone. And never be just like you were never gone. And you never come back if you ever come back now.
Kiss 92 traffic.
No news from the roads in particular right now, just lots of peak hour traffic. If you spot anything, though, that I haven't mentioned, please WhatsApp us at 8855-0920.
Good morning, Singapore, and welcome back to Good Morning Doctor. And we welcome Dr. Tricia Chang, Deputy Clinical Director from Parkway Medicentre, to the show today. I just enjoy talking to doctors. And I especially am
loves going to
enjoying
doctors.
talking to you, Dr. Tricia. I mean,
Thank
when
you.
I go see my cardiologist, not that I have a heart problem or what, but every year I go and see him and do a treadmill test and stuff like that. I can stay in the clinic there, I mean, in his office, and we can chat for an hour.
And then he holds up everybody else
No, no,
that's actually waiting to see him for a good reason. Glenn Ong. Okay, so we're talking to Dr. Chang about urgent care centers, and you were talking about all sorts of services that you guys provide. Now we know that the A&E can be a really, really long wait. You
Yes.
know, I've experienced like up to 5-6 hours because obviously everybody who has or thinks they have an emergency goes straight to the A&E.
Yeah.
But for the urgent care centers, which is a walk-in, sometimes open till 10 p.m. till 12 midnight, how long is the waiting time for someone who wants to see a doctor?
Well, of course, it depends on the crowd and the queue.
Typically?
Typically, I think you can be seen within an hour.
Okay. Oh,
Yeah,
wow. Okay.
Definitely within an hour.
Actually, if you go to A&E or you go to urgent care, and if you have to wait very long, right, means it's not so urgent.
That's true.
Well,
It's true, right?
Yeah.
I don't know. I've seen people look like they're about to pass out at A&E when still not being looked at. And I've been
Yeah.
with my dad as well, who's like at chest pains and stuff like that, and still sitting there because and I can see the doctors and the attendants being super stressed out because everyone's going up to them and going, "Why aren't you seeing my father? Why
Yes.
aren't you seeing my kid? You know, their limb is falling off or whatever it is. You know, it's an emergency to everyone."
Yeah, so I think the A&E, generally, A&E, they have this triage system where they actually filter patients into priority 1, priority 2, and priority 3.
Yeah.
Yeah, so priority 3 is generally patients who can walk, they're quite well, they're otherwise here for minor ailments.
Urgent care.
Yeah, most of the P3 patients actually can be seen in the urgent care, or some is even in the GP clinic.
Oh, what about the second stage ones?
Priority 2, usually they will be on beds, like trolley beds. They're probably more sick, and they may require admission. And priority 1 is like they need to be resuscitated.
Oh, right.
Like,
Okay.
super urgent.
Or
Usually
they're
people who come to
life-threatening.
A&E in an ambulance will probably be priority 1.
Or 2.
Or two, or like they're bleeding profusely and
Yes.
need the care straight
Yeah,
away.
So the priority 3 is really the that group could have been seen by a GP or
Yeah.
maybe urgent care.
Okay.
Yeah.
Okay.
Yeah.
So,
There should be nurses there, for priority 3.
Three.
Go up to them and scold them.
but it's interesting that you mentioned that. So will all hospitals eventually, hopefully, have urgent cares attached to their A&Es?
There are some already in
Okay.
the vicinity, like I think Woodlands and
Nearby.
Yeah. There are some partnering institutions already. So I think this trend will continue to grow. Yeah. So as people's awareness grow as well, hopefully they know where to go.
Urgent care, man.
Urgent
First time
care.
I'm hearing
Urgent
of it.
care, I know, I'm
absolutely
thinking-
brilliant.
UCC.
Urgent care today.
Urgent care. It's
Today.
called UCC,
Yeah,
right?
UCC.
Okay.
I don't know whether mine is urgent. You know why?
No.
Because before I go for urgent care, I'm going to the gym to train first.
You see
see?
that
And
already?
then,
And you know what? He's still walking, so I'm not sure
I'm
it's
limping.
broken. But you're still walking without aid,
But I
see-
go to the gym, train first, and then go and check,
right?
see if my
Doctor,
foot is
what do you have
broken.
to say
Yeah.
about patients like this?
See us first.
GP first.
Yes, definitely.
Don't work out. Don't work out.
End of the day, he's not giving his leg enough rest.
Yep.
Okay, anyway. It's 8:15.
Kiss 92 time check brought to you by Poo.
Yeah, he's a sucker for
I'm very
pain.
patient, that's why I want to run again.
It was running that caused
So
it.
we have physio as well.
Oh.
Under one roof, under our Parkway Medicentre.
Woodley.
We have a physiotherapist, we have psychologists as well.
Ooh,
Okay.
Yeah,
you've
so-
always wanted to sit on someone's couch.
Yeah, so we have so there are many cases like you, for example, they sprain their ankle or they injure themselves at the gym, at the back after a deadlift or whatever, and they come and see us and we say, okay, we do an X-ray. X-ray is clear. I say, why don't you see my physiotherapy?
Right.
And if they have a slot today, see immediately.
If you guys have a membership, I'll join.
Yeah, yeah.
and if the physio can't help you, she'll send you off to the psychologist.
Yeah, so I think there's a lot of good feedback from patients who went through this journey, doctor, X-ray, physio, because they are in pain, right? They are reassured that there's no fracture. The physiotherapists work on them immediately. They can do some heat therapy or whatever therapy that's needed, and they teach them exercises on how to protect their back or the ankle and all that. And they spend like maybe 2 hours in our clinic. 1 hour is for physio. The rest is the consult and the X-ray, and they walk out so happy after that.
Oh,
Yeah.
okay. That's good to know.
Can I ask you, I just want to know the difference between, since we're talking about fractures and all that, and you're a doctor, what's the difference between a hairline fracture, a stress fracture, and like a fracture?
Well, hairline fracture, which sometimes can be missed on X-rays, it's really literally just a small line across
Like
the
a hairline.
body, like
Which
a
should
hairline,
heal quite
which
easily.
is very, very, very mild, and
Okay.
probably no action is needed.
Okay.
But
Yeah.
there's still pain.
There might be pain, because you did probably injure that area. There's some trauma to it. Yeah, so that's hairline. Stress fracture is usually like from maybe repeated running, marathoners, overexerting that bone.
Okay.
In a sense, it may cause a stress fracture. And of course, if it's like an open fracture or an angulated fracture, a displaced fracture, that's a bit more serious. May need what we call manipulation and reduction back in place. Those will be a bit more serious and probably may even need specialists to take a look.
I see.
So the fracture is the same as a break?
Yeah.
It is the same thing as a break.
Yeah.
Okay.
Yeah.
I want to just go back to what you said. Some of the services are that you provide at the UCCs, which are the urgent care centers, mammogram screening.
Yes.
But this is under urgent care or maintenance.
Sort of maintenance.
Okay.
So just nice you mentioned it, because this month is the breast cancer awareness
Last month.
Yes,
Last
last
month.
month. Oh, yes,
Yesterday.
sorry, yesterday.
yesterday.
Yeah, October, month of
But-
October.
But every day should be, right?
Yes. So we do offer to our patients, especially those that come for health screening, do they want to add in this to their health screening if they have not already chosen it? And also eligible patients.
Who are the eligible patients?
So women,
Okay.
more than 40, maybe family history of breast cancer, or they are just worried, If they felt any breast lumps recently, we will definitely advise them to just do a mammogram today, and we just order it immediately, and they can have it done. They don't need to come back again.
Okay. So do you have gynecologists there under the Woodley Medical Center?
We do.
You do? Okay.
Yeah, that's
okay.
that. We have
They
one.
have everyone. You have dentists?
No dentist.
No dentist.
I'm listening to this and I'm trying to imagine the size of this.
I want to see
'Cause
what it looks like.
You offer so many different services.
Yeah.
Yeah.
We have a
It's-
pediatrician as well, in-house
Oh,
pediatrician.
nice. Okay.
So Woodley area is quite a young population.
Yeah.
So we have a lot of kids coming in, parents worried about their kids falling sick and everything. So yes, we also do refer to our pediatrician if it's needed.
Oh,
Yes.
nice. Okay.
Yeah.
Wow.
Sounds like we really can do everything there. We
That
should
really
go.
is quite something.
Yeah. You know, this whole family history thing, I just found out from my physio, and I don't know whether it's true or not, because she was looking at my foot now, and she went like, I think you're developing like a bunion.
Oh.
I'm like, what? I'm like, why?
You know,
Why?
it's hereditary.
Yeah, that's what she said.
Yep.
Yep.
Because
I'm like,
I
but
got it from my
nobody.
aunt.
I'm like, no. Oh, you have as well.
I have from my aunt. Yeah.
Yeah, so do I.
Yeah.
From my
What
mom.
the-
Yeah.
Right. So she said, yeah, it's usually there's someone in your family was who has it, right?
Who
And I'm
has
thinking
it?
to myself, no, my
could-
mom doesn't have.
It could be an aunt. It could be a grandmother,
My
grandfather.
father didn't have.
Skip
my
that generation.
brother, my grandmother. Then I went like, oh my goodness, it's my grandmother.
I remember her feet.
Because I remember, my grandmother used to have like terrible bunions.
That's went
She'll use
sideways.
rubber band to tie her,
Oh, no.
what do you call toes together and all that. I'm like, damn it.
But they have surgeries, but they're huge surgeries.
Yes.
I had a friend that
Yeah.
went for one. It's a massive surgery.
I'd
Shave
rather
off.
go.
Yeah,
Some
they
part.
they
For
shave it
surgery.
off, and then I think you're unable to walk for a month maybe. You're out of physical activity for a while, like 3 to 6 months
Yeah,
kind of
but
thing.
better than tying rubber bands.
No, don't tie rubber
around your-
bands. It doesn't work. It's like an
Your
old wives'
toes.
tale.
Bands. That's a new one.
You have no bunions, huh?
I have.
What?
On both feet.
Oh,
Yeah.
mine's
both feet.
worse on one side.
Yeah, mine's worse on my right foot. Than
Mine's
my
I
left.
can't believe it. Bunions are the worst, right?
Yeah.
Like your toes are disfigured.
Yeah,
Yeah.
But some people have it really, really bad where they're completely sideways.
Yeah.
Completely like. I've
So
seen-
what I'm doing right now is I'm doing exercises.
Are you
Toe
ru-
exercises.
Putting rubber bands.
No, I'm trying to
Stretch
move.
it.
I'm trying to move my table with my toe now. Just to,
You know, then tomorrow he'll
Just to
come into
strengthen
work.
your-
He'll come into work. And you go. I think I fractured.
yeah,
my
so I
toe."
put my toe down there and I use it to like move it.
Is it your left toe? It doesn't work.
Left toe, yes.
It doesn't work.
But the problem is, I think I made it worse because this morning when
Yes.
I woke up,
Your toe hurt.
my whole foot hurt again.
Okay, you see, now you've got 2 hairline fractures in your foot and a dislocated big toe.
There you go. You know what it actually is, right? It's the bones that are growing at an angle, right?
Dr. Chang is
yeah.
starting to get to know me a
tell us
little bit better.
I know
now.
you're not a podiatrist, but
Yeah.
tell us a little bit more about bunions, though.
Well, I think most of the time is because of poor fitting shoes.
Yeah.
Heels as well for women.
Heels, V-shaped shoes,
The pointy ones.
shoes that are so
Ooh.
beautiful, right?
Yes.
We love pointy shoes,
But they're so painful.
They're painful. Long hours of standing, working, walking. For guys as well, I think some of the leather shoes are quite
Yeah,
Yes,
quite pointy,
my dress
yeah.
shoes, my tuxedo shoes.
Yes, so those are really
Bad.
Yeah, so you need to find shoes with bigger toe boxes,
Wider shoes.
wider shoes, maybe not so pointy, more round. And he's showing me his feet now.
But what do we do?
Everybody.
But what do we do when we have
Better.
bunions?
Yeah, so avoid those shoes. of
Okay.
course. Yeah, avoid those
Only
shoes.
these.
Wear sports shoes. I always advise my patients just wear well cushioned, white toe
Comfortable.
box kind of shoes, comfortable kind. If you for women, of course, if heels are generally bad. Actually.
Yeah,
bad
they
for
were
your back.
invented by men, so
Oh, really?
I'm sure.
Oh.
Yes.
Well, men were the first ones
Men
to
were
wear
the first
them.
ones wearing heels.
Men wore heels before women
Yep.
did.
Oh dear.
Yeah, it's you guys that make us wear.
When we
shoes like
come
that.
back, I'll tell you another thing that can cause bunions and what caused mine.
Okay.
All right. Back with more of Dr. Tricia Chang. Stand by.
Kiss 92 traffic.
Just one situation. This is on the PIE heading west towards Tuas. After Bedok North Road, an accident has been reported is causing quite a backup to Bedok North Avenue 3's exit. Look out for that and stay safe.
Welcome back to The Big Show and The Big Show TV. This morning we say good morning, Dr. Tricia Chang. Welcome to KISS 92 and welcome to The Big Show. Dr. Tricia Chang, of course, is the Deputy Clinical Director at Parkway Medicentre.
Thank you, thank you. Thank
So
you.
we've all discovered that we have bunions. Doctor, another thing that causes bunions, and I only discovered because my bunions got very bad after I started doing this, dancing.
Oh, really?
Salsa, bachata, ballroom.
The shoes.
It's the shoe.
Because of the weight you put
And you're
on the ball
yeah,
of your
because you're
foot.
always on the ball of your
You're always
foot.
on the ball of your
Yeah.
foot.
Yeah.
So that creates bunions.
Yeah, mine are so painful sometimes when I'm in heels because we do hosting and we have to do public speaking and stuff like that. That they throb.
Oh,
They're so bad that they throb. Yeah,
I didn't
especially
know.
my left side. Yeah. So
I don't
and-
feel alone now.
Yeah, you're not alone. Bunions are like a worldwide problem.
You
So many
guys
people
can-
have them.
Can
Compare
move the
feet.
table together.
We can move. No, nobody's moving any tables. So we're talking to Dr. Tricia Chang about the difference between the A&E, the GP, and the urgent care center. Can you just do sort of like a wrap up and tell people what the differences are and when they should or shouldn't go?
Okay, so I think generally if you think that your life is in danger, your limb is in danger, or your vision is in danger, these are very, very life-threatening things that you should definitely head to the A&E. Okay, if it's none of the above, you can consider, can you go to your GP, your primary care provider, or the urgent care center? Okay, primary care provider, for most of the people, they usually go to a regular GP. It could be for new symptoms, acute conditions, chronic conditions. But the GPs generally, they also are able to deal with sort of urgent conditions, but they may not have the facilities or the support to give you treatment all the way. They may need to refer on. Yeah, so urgent care center is sort of an in-between between the GP and the A&E. Okay, if it's urgent but not life-threatening, you can consider urgent care center. It's definitely a good alternative to the A&E, and this will also help to shorten the A&E waiting times. And those patients who really need A&E treatment can get them in a faster manner. And you can also get your problems treated at an urgent care center.
Okay.
It's
Yeah.
brilliant.
That's-
Everything under one roof.
Now we know.
I love it.
Love it.
It's a
Parkway
great
Medicentre.
idea.
And if you want to look for Dr. Tricia Chang, she is located at Woodley Mall.
Yeah.
Yeah, Woodley Medical Center.
Yeah.
Yeah, nice.
I'm going to look for you. soon.
Okay.
And they have their grand opening tomorrow. So
Yes.
congratulations.
Congratulations to Woodley Mall. Okay, thank you very much, Dr. Chang, for joining us today.
Thank you, thank you.
Thanks for tuning in to The Big Show's Good Morning Doctor, brought to you by Parkway Medicentre.